Tuesday. My name is Claire. I am the founder of StudentRDH. I'm wearing pumpkin color just because it's October and we are approaching Halloween. Other than that, I've been working on some memory techniques again today. I've been working on creating some videos for you guys. And you know what's really important? I've been creating this short mock exam. Anybody here, I want to see if the chat is working, first of all. Anybody is going to take the examination by December or so? You can put it here in the chat if you have a rough idea of when you will take the board examination. Is it January? Is it May? You know, Michelle, October 30th, okay. Anybody else who is taking it sooner than later? So the reason I'm asking this is because, you know, Michelle, that the board is going to do a short examination, right? Am I correct? So the short examination, short format is something that we have been working on. So we give you a mock exam that is just like the short examination. So you have the same amount of questions and you have the same amount of time. So you really practice, you know, with what you're going to see. Because we have the mock for the long examination, which is a normal examination, but right now nothing is normal, right? So you will see it in a few days, Michelle. It's going to be up. So I'm sure that's going to help you prepare for the national boards, okay? I would love to know, everybody who is here, where are you from? Which school you're going? And I also want to know when you're graduating. So put that on the chat. And I would love to just share everybody's story over here. So we have iPhone. Is there a way that we can get your name, please? iPhone. Michelle, you are in Toronto. Michelle, I'm going to tell you where I am. Young and blurred. Does that sound any familiar to you? I'm right now sitting in Young and blurred. Yes, thank you. Michelle, where are you? Are you close to this area? So Anthony, you graduated in New Jersey in June 2020. That's why we have you today, right? In order to talk about some of the things that, you know, that will help the seniors. We have Hannah from Forsyth. That's where I went, Hannah. Okay. Right now we have New Mexico 2021, and we have Zin, Kentucky, May 2021, Alyssa, Idaho, April 2021. We have Becca. Hi, Becca. 2020 graduate. Love seeing, you know, I've been talking to so many of you actually, though, previously, like probably via email, and some of you have recognized your name from Instagram as well. And iPhone, you are Vanessa, okay. Arizona 2021, Ashamar, Jamaica, awesome. Finished school, almost or ish, you know, you're graduating this year, but COVID, hey, anybody has been delayed because of COVID here, like you can tell me, oh, my clinic is running slow, or we're not allowed more than 20 students at a time, or, you know, I'm just trying to understand what the situation is, because every school is a little different. So thank you again for everybody for sharing your story here. You know, I'm just happy that everybody being able to join. I know we're a weekday, so it's a little harder, but we're going to record this just in case someone wants to learn from us. And a lot of times right now, students are in clinic and everything. So that said, I would love to just share a little bit about some of our presenters today. So Becca, you're here already, so that is wonderful. You are from Indiana. My sister, who is my co-founder, she graduated Purdue, not too far from Indiana University, right? And I've been there many, many times. You know what I love? The Indiana Museum of Art. Indiana, I think that's a good one. I really like it. And you can turn on your microphone and you can speak too.
Yeah, it's a great museum. So,
yeah.
And that you are familiar with IU or Indiana.
Yeah. Yeah. I mean, it's a small museum, but I thought it was solid. I loved it. Mm-hmm. And you know, next year Under One Roof is going to be in Indiana, so maybe you'll be around.
Hey, that's
awesome. So we have Becca who's going to present today. We also have Brittany, who is, are you here yet? I know Anthony, you wanted to come earlier. I think we had a misunderstanding. So, you know, let me know. And, you know, maybe we can start, let's see, Brittany, are you here? I see, oh, you're Brit, am I correct? Okay, sorry.
I'm here. Can you
Awesome,
hear
awesome, thank
me?
you. And, you know, we will talk a little bit more about Brit because she does some awesome things other than being a fabulous clinician. So, you know, anybody who wants to go first over here, I think I scheduled Becca first to present to our new grads, or not new grads, senior year student to how to be excellent in their last year. Are you ready, Becca?
Yes, ma'am.
All right, so I'm going to make you a co-presenter, a co-host, and you'll be able to share your screen if you have something to share. And I really appreciate you taking the time to speak to our students here. And again, not many have been attending to it right now, but we're recording it because I bet they want to see it after they get out of school.
For sure.
Yeah. All right.
Okay, let me just pull this up.
Yeah, I'm starting your screen, seeing your screen. Perfect.
Okay, let me make sure. Is that the screen with all the pictures?
Yes, yes, you are. Are you guessing or
What's that?
are you guessing you don't see your screen or you see it too?
I see it. I just want to make sure that it's showing up.
I guess the same. Well, I mean, I see your dog too.
Perfect. So, I just wanted to share a little bit about myself. As you can see, I am a dog mom. We have two little puppies. Scout is the white and brown one on the top, and Bella is the one on the bottom, and she is just 4 months old. So she's just a little pup.
Mm-hmm.
Some of the things that I do in my free time is I love to bake. I'm also a florist. That's what I was before dental hygiene school.
I was too.
Really?
Yeah. I used to work. That's crazy.
I love playing with flowers. So, and then you can see my husband and I here.
Really beautiful.
I actually now have 2 bachelor's degrees. I got my first undergrad at BYU in Utah, yes, in biology, and then back to and do dental hygiene school, and I graduated from IU just this year.
All right.
Dental hygiene school was kind of crazy, as we all know.
Yeah.
And my husband and I bought a house and totally gutted it and redid the interior. And so you can see on the picture with the flowers, that's like part of our kitchen.
Oh, wow.
A really overwhelming project to do in the middle of school. So.
Wow. That's all within school too. That's crazy.
Yeah. So, I'm going to just discuss networking for just a few minutes because this is something that has made a really big difference to me as I've started my career as a dental hygienist. And not just after graduation, but even before graduation too. Okay. And so networking, just for people who don't know, I think most of us understand it. It's the action or process of interacting with others to exchange information and develop professional or social contacts. Mm-hmm. That picture there shows network. It looks like a big net. Mm-hmm. So-and-so knows Claire, and Claire knows so-and-so, and, you know, Claire connects so-and-so and so-and-so. You know what I'm saying? And so it's a big network. And so I like to always think about things with the phrase, like, what's in it for me? Like, what benefit is there me as, you know, a recent graduate to network? And I can only speak from experience for myself. But these are some of the things that I have been able to have the opportunity to do because of networking. So I have my dream job. I work 3 days a week, 11-hour shifts or so at a private office in Elkhart, Indiana. And I am really, really loving it. I love that it's a small family-centered practice, and it just really fits well with my personality. Also, and I didn't really apply for that job. I was introduced to the office manager because I volunteered for a community event. And I have multiple standing offers for other employment. It was really nice to like just graduate and not have to apply for a job. There were people contacting me because of things that I had done, and they remembered me because of conversations that I had had with people. Also, because of networking, I'm going to be published in RDH magazine.
What? Oh, yes, you're right. I mean, wait, have you already been published?
Not in RDH. I have been published for RDH graduate.
Wow. Yeah.
IQ. Yeah.
Oh, that's very exciting. What is the topic, Becca?
It's whitening. So the topic is how to help patients have realistic expectations for their whitening results.
Oh, wow.
So yeah, it's a really exciting gig. So it's you'll be getting it in the mail.
Oh my God, I can't wait. Yeah, I get it in the mail. Hey, congratulations. That's really a big deal. Yeah, I mean, you're such a young grad, and being able to just get to that level, top.
Thank you. Thank you. And I started writing about a year ago, and I started with RDH graduate with Amber Auger.
Yeah.
And I'll explain a little bit about how I got involved with that.
Sure.
And I wrote an article for you, Claire.
Yeah, I remember that. Thank you.
Yes, and then some other things is through networking, I have some of the dental hygiene professionals in my state have invited me along to some of their like meetings with lawmakers.
Perfect.
And that's been a really cool opportunity, although COVID happened, and so I wasn't able to go in person. But in addition to mentorship with others, and then of course valuable relationships and satisfaction in your career.
Wonderful. Well, hey, seems like it's right on the topic of networking, as you're saying.
For sure. So where do you network? And this is something that as seniors, you have the opportunity to do now, and you've probably had opportunities in the past and maybe you took advantage of them. I hope you did. And if not, it's never too late. So you can network with professors, other RDHs, and dentists. Dentists who, maybe you have your clinic dentist and he has a buddy who, is in need of hygienists, and he'll say, hey, how about you go apply at this office or whatever. Community volunteer events, that is how I got to know the office manager at my job, was through a community volunteer event.
Mm-hmm.
Guest speakers, webinars, and CE events. So right now, believe it or not, you're networking.
Yeah, you're right.
Yeah. And so I put a picture of this pretty blonde lady here. This is Jackie Sanders, and she came to IU and did a presentation on professionalism when I was a junior. And yeah, she's at the time she was she worked at Sunstar as part of their professional development.
Correct.
Now she is the chief editor of RDH magazine. Correct. And afterward, I walked up to her and I just thanked her, and we started chatting. And she was like, "Hey, if you ever want to write, here's my card. Get in contact with me. Send me an email." That opportunity, and contacted her, and she's been the one that I've been in contact with ever since. Yeah. With Amber to do RDH graduate, and then she asked me to write an article for RDH magazine, and then I will have one of the one of the big articles in February, so it's really exciting. So I'm starting to work on that article too.
Right, that is fabulous.
And then additionally, like publishers and product reps. Like the Colgate rep came to my school, and like she still emails me. Sent her a follow-up email saying thank you. I really liked what you said. You know, and that leads me to my final slide about how to network.
Mm-hmm.
You start by flashing your smile.
Okay.
A smile goes a long way. It lets someone know that you're friendly and that you're open to someone.
Mm.
Introduce yourself. You know, for me, it'd be, hi, I'm Becky Nielsen. And then the conversation continues. I'd like to thank you for your presentation. I really liked what you said about blah, 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 blah.
Yeah.
You know? And that opens the door for the conversation to just continue. And so really that's like all the work that you have to put into it. You need to be a good person, be sociable, be positive, and then when they give the opportunity to like for you to do something, like when Jackie said, here's my card, send me an email if you're interested, I jumped at that opportunity. So similar to when Claire asked me if I'd write an article for her blog, I said, absolutely. That's networking. So it doesn't have to be really complicated. And I think that that's something that has really made a big difference in me in my start of my career. Even if you don't know, like maybe you don't want to write or anything, but there are other opportunities and other interests that you may have, hygiene or even outside of dental hygiene, where networking can play a key role in helping you achieve those, you know, your goals and desires.
Right. Wow. That, I mean, one of the things that you said still resonates with me. It's like, you know, even me, I'm still trying to network, right? My job is not done, right? My goals are not met yet. I mean, I'm still, you know, actively working and networking. Sometimes I do feel shy, right? Sometimes I don't know how to approach people who are way bigger than me. But you know, the few things you said, start with a smile and say, well, I really like your presentation because of that. Such an easy things to say, right? Just take one point of the conversation, just speak and just say, hey, I like that. And then that really starts this connection.
Absolutely. And I think that that lets the other person know that you were paying attention, and the fact that you were approaching them now, like that helps them open up too. We don't really worry about them shutting us down at that point, because if we approach them, they're passionate about whatever topic they're doing, whatever thing they're doing, and so they're willing to continue the conversation.
Mm-hmm. Awesome. Wow. Well, thank you very much for sharing some of your, you know, personal stories. And I'm just very impressed how proactive you've been. You know, it's not easy to do as a student, because maybe some of us can relate to, like, you feel small when you're a student, right? When you're a new grad, you still feel small. Like, do I deserve to be in RDH magazine? Do I deserve to talk to that person? Right? So I really love the topic of that. And anybody here that would love to share something, maybe a struggle or something that they have experienced, because, you know, I think we're very lucky to have Becca, who is such a proactive person. And maybe I can ask you, Becca, when you do things like that, how do you feel inside though?
How do I feel inside when I do things like that? I mean, initially, honestly, I'm kind of scared to death. Like,
right.
And I invited Jackie Sanders out to breakfast. I was like,
oh my gosh.
But she said yes, you know.
Jackie like that. She would
I'm nervous, but it's like it's just so satisfying, and I feel like rewarded. It feels like, you know, the career path that I have chosen not only like provides for me financially, but it also provides for me like emotionally and socially.
I see, I see. Wow. And that is just an excellent move. Can I buy you breakfast?
Right.
Right?
But
Okay. I'll tell you that's bold because I haven't done that to Jackie. Jackie took me out for lunch, but I should have done that.
well, Claire, when you come to Indiana next, I'll take you out to breakfast. Okay?
Yes, let's do that. I would love to. Oh my God, thank you so much. Hey, this is, this fantastic topic. I didn't know what to expect today, but I hope all of us learn something. If you want to comment on something, even if it's positive, if you have something you're trying to solve yourself, just let us know here because Becca is still available and really just sharing her story. Now, Becca, my question is to you. What else is there for you? Because it seems like you're like, go, go, go.
What else is there for me?
Yeah. Like what other things you are interested in?
Oh my gosh. Other things I'm interested in. Are you talking about within the career or like outside of it?
Oh my. Okay, let's start with within the career.
I mean, I'm I'm hoping that someday I have the opportunity to teach.
Mm-hmm.
Um, I would love to eventually. I'd love to do grad school, get an MBA,
Mm-hmm.
um, or a master's degree in education or something.
Wonderful.
I think I'm honestly leaning toward MBA at this point. I just think that's
Very
something
nice.
I enjoy doing. Um, I'd love to keep on writing. And then outside of the career, more recently, I love to sew, I love to bake, and I have like a little side gig that's kind of fun where I sell, I make like wreaths and I sell wreaths like for the.
Oh, wow.
That's a little floral side hobby gig I've been doing recently. So
Very good. Well, hey, hobbies are important.
yes,
Gotta get your, something that makes you happy. Uh,
definitely.
well, everybody saying congratulations on the article. That's what Hannah said. Michelle said, so amazing. You have accomplished so many things at a young age, and I do agree with that. Um, you know, let's take just back with just what you talk about networking. So what other networking could happen within school? Let's say if Jackie didn't come to the school, what other opportunities? In my head, I feel like, what, your faculty are also your network. So they can hook you up with jobs. And a lot of times you go back to teach where you came from. So keeping in touch with them is also really, really important, right? Just checking on them once in a while. Hey, how are you doing? I was thinking about teaching. Do you have, can you look at my resume? Or, what am I missing here from being an awesome clinician? They're happy to do that. And you know what? It goes both ways too. I help my faculty get a job too later. So, it's networking as you described, it's like that. It's like just all tangled. There's no like one directional way that the networking can go. Well, that was excellent, Becca. I really enjoyed it. I hope all of our dear friends over here enjoyed the topic. And anybody who's going to watch this later as a recording, I think will also find this very inspirational because, again, you're speaking from someone who's so young and who accomplished a lot and, from graduating dental hygiene school. So big thank you, Becca, for just being with StudentRDH, for writing for us too, and just for being an inspiration for the next class. And I really look forward next month to see your article.
Yeah.
Becca, what, do you have an Instagram? I'm just trying to think like, because like Instagrams are very different than real names. So if you want to do a shout out for yourself here, follow me here. You're free to do so here on the chat.
Okay, I will put my information in the chat.
Yeah, and we can see some of your floral design as well.
Yes, that's mostly what I post. So
Oh, you know, the thing, I mean, the red, is that how you pronounce it? Sometimes I get stuck with the pronunciation because I was born in Korea, but I grew up in France, and then sometimes my pronunciation gets mixed up. So you're talking about this, right?
yes, the wreath.
The wreath. Okay, that's how you pronounce it. Those are not easy to make, though, actually.
No, but they're fun. They're
Yeah.
really fun. So I'll put my Instagram on there, and if you guys want to see wreaths, cute dogs, and cute little dental hygiene stuff,
Well, yeah.
add me.
Thank you again, Becca. And if there's an interest that you have, because you've been so good to us, email me anytime. Jackie has an amazing connection with everybody, and I do think I know quite a few people too by just doing this. So anything that interests you, and otherwise, I feel like we can meet next year in Indiana.
Sounds good, Claire. Thank you. I'm excited to listen to what the other people have to say.
Sure. All right. All right. Thank you so much again. I love when students present. It really just makes me think, you guys have so much to share. It's not just about me as student RDH. It's just about everybody. You're all contributing. So everybody who is sending some awesome thank you to Becca. You guys are also awesome. So now I would love to invite Brittany. Hello, Brittany. Are you here? You can unmute yourself and we can talk about, Brittany has a few things going on for herself as well. So, talk more
Hi,
about yourself. Hey,
how are you?
I'm great, and I hope everybody's doing good. I'm wearing my pumpkin jacket for
I
October.
love that color
Right.
and your glasses. I was just looking through I have a drawer that was kind of messy and I was like, where are my glasses? I'm not gonna be able to see far away. I like your lenses.
All right. Yeah.
Yeah, but a little bit about me. I just graduated earlier this year, in July. I was supposed to originally graduate in April, but with everything going into online, it pushed us back just a little bit.
Right.
Yeah, but I'm excited. I put this PowerPoint together in hopes to just help people who are about to graduate and those who did graduate and just get the next steps.
Mhm. So, and you will tell us a bit about your brand as well, right?
Yeah. Do you want me to do that now?
I mean, whenever you want to, whenever you
Oh.
think it's appropriate. So I just don't want to miss on that because, you're
Yeah, I just have I have an Etsy page and I make totes and keychains, and I'll soon be doing shirts with scalers and just I like vibrant, colorful things. I have some keychains here that are really shiny and stuff. So I have that listed on the end of my PowerPoint so you guys can see.
Oh, okay. Let's do that then. Yeah.
Yeah. So let me, oh, I can't share my screen yet.
Oh, I need to give you the co-host option. That's right. All right. Coming up.
Perfect. All right, let's do screen. All right, can you see it?
Let's, not yet.
No, not yet. Okay, let's see. Let's stop this broadcast and start it again.
Oh, it's starting. Good.
All right. Perfect. Can you see my PowerPoint?
Yes, we do now.
Perfect. Okay. So, about me, I was born and raised in California. I've been in RDA since 2015. I'm a recent dental hygiene grad from Carrington. I'm creator of My Flossy Posse, which is an Instagram, and just recently I made that Etsy shop that I was talking about. And I added this random fact that I'm a Hufflepuff. And the reason I did that is because when I was in school, our program director was really into Harry Potter. And she did a Harry Potter day, and we all wore the hat, and it decided what house we were in. So people who are Hufflepuffs, we just get each other. So that was
right.
just a random. Yeah, so that's my dog Bailey, and that's just me in class or in clinic.
Perfect.
All right. So let's say you just graduated and you took your board exam and you took your credits and you're like, okay, what do I do next? So after you take your board exam, you have about 2 weeks to check if you've passed the written exam. Then you can start your application process. So in this PowerPoint, I've added a lot of the links. So if anybody wants it, I've added my email at the end of this PowerPoint so they could just email me and I'll just send over this short little PowerPoint. So that's how you'll be able to see on the status that you've passed or not. I know that you have an awesome video on YouTube that if you don't pass, it helps you to figure out how to read your scoreboard, you know? So that's awesome that you have that and very helpful. So on this link on the bottom, it says start your application. Let me see if I can do my little PowerPoint. Oh yeah, you can do it. Okay, so this link right here is where you'll be doing your application for your RDH exam. So before you apply, you want to get your checklist from this link right here. It's just a good way for you to have your own checklist to make sure that when you do apply that you're sending everything needed so it doesn't hold up your application process. So I added a few photos here on this side, but just keep in mind this was what we had to use for my school. So meaning this Carrington thing right here, this Carrington form is just a form because they gave it to us since it took a long time for us to get our diploma. So we sent this, which our program director just basically said, this was the date you graduated. And then once we got our diploma, then we had to scan that and attach that with our application.
All right.
So when you're an RDA, you want to make sure that you contact the dental board about 30 days prior to you planning on applying, because it takes them about 30 days to get you this form. And that form just lets them know that the status of your RDA, whether it's currently active or not active, but they just want to make sure that that form is attached to your application. Am I going too fast? I'm sorry.
Great.
So,
perfect. Let us know on the chat if you have some questions or there's something you want to mention, okay?
Yes, please do. So when you pass your board exam, the national board exam, those results will get sent to the board. So you're not going to get anything in the mail that you passed, but when you pass your credits, or I'm not sure with rebs, but with credits, you'll get this gray form along with an envelope that says do not open. With that envelope, you want to send that specifically. You'll put the address that's here. Let me see, the dental board address, which is like Evergreen something or Everest. You'll put that on the front and then you'll mail that. Don't open it, just mail it. This gray form is what you'll scan and attach to your application. So I did all my application online and other people mailed it in, but I figured the online was pretty fast for us. If you're married and your name changes, they want you to upload your marriage certificate and then your request for the live scan. So that's just a little list of what they want you to be uploading, along with a passport photo. It's a passport style photo, so as long as it's a plain background and nothing's crazy and it just shows like shoulders and above, they accepted it. I didn't submit a passport photo, but I just had it super simple.
Sure.
Let me see. Yeah, so on the bottom it says it takes about 30 days for them to get that RDA certificate. So apply for that prior to you doing your application for your RDH license. So for the fees, when you apply for your RDH exam, there's a $200 fee for, let me see. Yeah, the $200 fee for the application and then the license. So you'll be paying $200. The live scan separately is $70 to $90 depending where you go. And then once they process your application, you'll have to pay $28 for the law and ethics. So it just gives you kind of a map of what to expect once you pass your board exams, what you're going to want to just prepare your funds for.
Yep.
Um,
Few things to prepare. Yeah, it's not just over.
Yeah. After the
Trigger.
for we wish, huh? So it takes 2 weeks to find out your results. So earlier in this PowerPoint, you were able to find that link to where you can check. And then 30 days, the dental board will process your application. So I sent mine on September 9th, and I didn't hear back until last week.
Okay.
Yeah, so it takes time, but it's all a waiting process. So throw your timeline out the window, because it's gonna happen.
Yeah.
You're gonna become an RDH, just be patient. Yeah, so after they process your application, you'll get a letter in the mail letting you know that your application has been processed and that it's complete. It will also show up on the PSI website, and it will allow you to schedule your law and ethics exam. And at that time, you'll pay the $28. For me, I just called and scheduled to the closest place next to me, and it was pretty soon. They were able to schedule within the same week. So once you get your law and ethics, I think it's going to take a few, like maybe at least a week for the license to post. So when it comes to job searching and interviews, so in my program, what our teacher had really pressed on us was just to do your research, where you plan on working, what are the hygienists in that area, receiving as for pay, just knowing, being confident that yes, you're a student, but your knowledge is so fresh and you are willing to learn, continue to learn. And so there's such strength in being a new grad and being a student. So go in there confident, just prepare yourself, know that they're going to be asking you questions. So just hold yourself as the clinician that you are and be confident and tell yourself, like, I'm going to treat my patients with the best care that I can and be the best hygienist that I can be and be an asset to this team. And just really go in there confident, because if you go in there and they can feel like, oh, well, you're just a student, you just graduated, you're not, so there'll be a little tug and pull. So you just go in there confident and know that you did your research. And if you go in there and you feel like maybe this interview isn't meshing well with the vibe that you feel comfortable in a day-to-day office, it's okay to, politely, once that interview's over, and if it doesn't go well, it's okay. There's other opportunities. Just remain confident in the clinician that you are. So, preparing a concise and professional resume, just making sure that you're listing everything that you possibly, that you're treating your patients well, if you're licensed with laser, all of that you want to list on your resume, of course, just so that they know the education that you have and the experience that you have, whether you have past dental experience or not. And just like I said, anticipate questions and plan responses. So if they want to know, what are your career goals? Where do you see yourself career-wise in 5 years? Make sure you take some time a few days prior to the interview to kind of ponder those thoughts. Or when you're going to start job searching, write down a list of possible questions that an interviewer might ask you. So you can kind of have not a pre-answer, but feel a little bit more confident in your answers because you've thought it out before, rather than going in and they ask you, so what do you think, or why should I hire you? And you're like, why should he, or why should she, So just having that plan and going in there confident, like I said, and know your worth. You were an amazing student. You got through. Hygiene school is not easy.
It's hard.
It's not easy. So for you to be at this point to where you finished your exams, you're graduated, it's time for a job. It's like such an amazing, I'm like your hygiene sister over here clapping for you because I get it. I get how hard you worked. So go in there, you got this, and just be the amazing hygienist that you are going to be and that you have been. So I added here my email. If anybody wants this PowerPoint, because some of the links or whatever, just feel free to email myflossyposse@yahoo.com, and I could just send it over to you. It's like maybe 6 slides, I think, or 6 or 7. And then I also just added Instagram for my Flossy Posse. I just post it's literally a timeline. So from the beginning, you can see me just assisting, and it was even before I got accepted into the hygiene program. And then the process of getting accepted, starting school, 3 weeks in, 6 months in, 4 terms in, so it's literally such an awesome timeline to see. I was just talking about it with my mom. I was like, I'm so glad I started this page because it's literally like my personal photo album of hygiene. You see my classmates, you can see my lockers, you can see when I did anesthesia on my classmate for a first time, it's just like this, and it just
good memories. Now when you were going there, you probably wanted to just hide under the covers a few times, but now everything is done.
And it's when we had just even hard weeks with like, there was probably 12 finals in 1 week, and those are hard weeks, and I would just post something encouraging, and I just remember telling myself, like, when I graduate, I want to continue doing that for students and continue encouraging them, because just because I'm through those final weeks doesn't mean someone else is out of that yet. So I just want to continue to encourage students as much as I can, because they're where my heart is. So yeah.
All right. Well, hey, it's awesome that you started your passion business as well, though. I want to, I've seen constantly you're very active, and I want to congratulate you on that too. Not just being an awesome graduate and being able to tell others how to interview, things like that too, and being an awesome clinician, but sort of the milestones in life as well, creating your own little baby of some sort. So yeah, please follow Brittany. It's Flossy Post.
My Flossy Posse.
My. Okay, so don't forget that. And I mean, you also have some stickers, don't you?
I do have some stickers. Right now, what I have next to me, I have these tote bags, and these ones have my name on them because when I practice, I like to just put my name just in case. So I have these. I'm really obsessed with like holographic things. So this one, people really, really like this one because the rose gold, and the totes are a cute size, and some of my keychains, and But when, if you want my PowerPoint, I'll send them to whoever emails me. And then that has my Flossy Posse Instagram and my Etsy page, because there's lots of stickers on there and decals. And I have a really cute laminated thing for Happy Tooth, Sad Tooth, the game. So like when you go to elementary schools to do community outreach, it's just a happy tooth and a sad tooth, and they get to put which food, like if it's candy or soda or water. It's really cute, so they should check it out.
I love it. You know what I would love to see is that, I don't want to create work for you, but it's just like a little thing, a few paragraphs maybe with like images, and then maybe we can post your website on it as well and put it in our blog, so whoever is curious can go to your site and either shop for the totes or shop for the happy and sad tooth. And I personally love some of the stickers that you have. So, I thought
thank you.
Very like in a bit humorous as well. It's just making fun of the things that we do as well. So I was really happy to contact you because I kind of felt even through Instagram that you have a passion for the industry.
Thank you. I do. And I'm excited to become a hygienist, because I feel like this is just the beginning of a journey. I'm excited.
Great. And, can I go back a little bit on that interview that you were talking about? So have you interviewed a few offices or one?
Yes.
Or
Two.
Okay, two. Okay.
Two, yes. And I took the positions for both of them because I'll be working split weeks.
Okay.
Yeah, so when I was assisting with this original office, but they interviewed me as for a hygienist position. So that one I just had to prepare myself on, because I didn't really know the hygiene, how they ran the hygiene. I only knew how to assist the doctor's schedule and what the doctor was really doing. The hygienist just kind of runs she's her own girl, So she's now being able to see that in my office was really sweet because I got to assist the hygienist for the working interviews, and it was an awesome experience. So for the first interview, it was an office that I was originally working as an assistant for.
Oh,
and then the second interview was for a different office, and it would be for Fridays and Saturdays. So for this office, it's more of a private, so there's no benefits with it. And then with the other office, it's more of a corporation, so there is benefits with it. So I'm just, and they both know I was very transparent about, okay, I'm going to be working here on these days and working here on these days, just so that they know, because I don't want to feel sneaky or anything. So I let them know, and the reason being is because I want the full experience of what their schedule offers and the type of patients that they see. And I know they do a lot of it's just like more of a general practice versus a private office that I've never been a part of that world, and I want to see that too, and the difference in how schedules are as a hygienist. And
well, and if Anthony's saying, sounds like a nice working setup, which is,
I hope so. I don't know, we'll see.
We'll get some updates later.
For
right?
Sure. I'll have to send you an update.
What about, have you seen some difficult questions?
Difficult questions.
Like when they ask you something, you're like, how do I respond to that? Like, did you have any freeze moments?
I think when she asked me they want to know how you're going to explain periodontal disease. So for me, that was something that for some reason, I didn't think that would be a question. Like, how would you explain a patient their gum disease? For some reason, that wasn't one of the questions that I had pre-thought, So that was something that kind of, I was like, oh, it should be something that I should know, So I just talked to her as if, okay, you're my patient and I'm letting you know. So I explained to the patient what health was, what gingivitis was, and where their periodontal status was. And I used my x-rays and I used my periodontal chart, and I just explained to the patient, when there's bone loss, we can't put the bone back, but we can stop the disease and we can control it. So our job as a clinician and as a patient, this is a teamwork thing, and I can't do my job fully, but if you're not doing your job fully at home, we're not going to see the results that we could if we were both putting 100%. So that was something that she was like, oh, I really like the way you explained.
I love it.
Yeah. So if you know you're going to have an interview, think of that question. How would you communicate with your patient you have gum disease or your gum is in good health? Simple things like that, because we want to be able to, we have the knowledge and the education. We can explain the oral biology, but the patient won't understand. So how can we simplify it to where we're still educating them in the way that they need to be educated about the disease, because it's a serious infection that they have in their gums. But how to word it properly for them, So that was something that it wasn't hard for me to do, but I didn't plan her to ask me that.
Okay. Oh, I love that question. I can see how challenging it could have been. to answer that clearly on the spot. So anybody who have heard Brittany and her answer, I hope you took some notes because that sounds great. If I was a dentist, I'm like, good. So yeah, some of the things can be related to what we learned already. I mean, obviously, this is the entire curriculum of dental hygiene: how to treat, how to diagnose dental hygiene, therapies, and you not only laid out clearly, but also I mean, the way you sound to me sounds very firm, which is awesome. Because patients wanna, they don't trust us. They don't come with like open hearts. They come with skepticism, fear. So if we don't say things with that kind of confidence, it's going nowhere. So I feel like you got like extra points there by the way you sound, which I really truly feel your confidence. So anybody who's taking notes here, confidence is something that is invisible, but that is felt. So if you don't have confidence, just make it up, okay?
And the ways to do it is like, say today in clinic, you passed your skill eval. Give yourself a pat on the back, boost yourself up, be your own cheerleader, because those are the moments that we need to be like, yes, girl, about, or yes, dude, like those are the moments. Because often as a hygiene student, I can tell you the first skill eval that I failed, I can remember everything I did wrong about it. And for some reason, we remember our failures so much more than the positive things that we've done and the successes that we've had. So I encourage any student, if you're going through it and you just feel like not confident as a hygienist, but the next time you get a good grade on your quiz or the next time you do good on your homework, you go, girl, give yourself an extra 20 minutes of TV time, or like give yourself a good shower with candles. You deserve it, because that's what's going to get you through the hygiene program.
Oh my God. And you know what's going to get through everybody's here and who's rewatching this? Brittany's going to get you through this. So
yes.
If you need something, you know where to find her. She's your girl. And obviously I'm here too. But I totally agree that, it's the celebration that counts, because we can beat ourselves up for the bad things that we have done, for failing something. I mean, I'm that type of person, and that just weighs really heavy. I mean, there's already heavy stuff in dental hygiene school. So, totally. So, hey, is that your move, putting some candles in the shower?
Yes, that's the best. You just have to. Oh, thank you. Someone looked at my Etsy shop.
Awesome. Yeah. And, I just want to applaud you for being that supportive student for everybody here and volunteering your time to share some of the things, because, as Becca mentioned earlier, I mean, we are trying to network, and this is a networking opportunity as well. And who knows how we can, help each other out down the road. And, regardless, I'm not here to tell you guys like buy StudentRDH. That's really not my goal. That's just really a small piece of the puzzle. I just hope that everybody can become the person they want to become, whether that means like working 20 hours clinically or 10 hours clinically. Everybody is different. So, I really look forward to see more things coming from you, Brittany. And
thank you.
And if you're in California, so may I have a request? If someone asks me like, Claire, I don't know how to apply for California or something, can I kind of redirect them to you?
Of course.
You're the expert in that specific area. And, I've been on the East Coast for a long time. So that's kind of, my experience has been, although I have the rev, I took every single examination that you can think of in dental hygiene. So,
of course, direct them my way. And even if I don't know the answer, I have connections with my professors who will know the answers. So we'll figure it out together if we need to be, if I don't have it already.
Right. And that's the goal, everybody. Just, StudentRDH, I don't want this to stop as just something that's like a board's review. Life continues, and just having some friends across the country who can probably answer a few questions, that's really counts. And who knows, everybody travels, relocates, and everything.
Of course.
And I will tell you right now, currently I live in Toronto. I was in Boston for like 15 years. And Michelle, is in Toronto right now. So, who knows where we're going to be now. I help a lot of Canadian students too, but hey, maybe some of you might move to Canada someday. And we have Canadian students who are going, new grads who are going to the US as well. And I might myself move back to Boston or something. Although I think it's a little too expensive. I'm like, if I can save a little bit, I would love to do that. So,
that's so funny.
And lastly, Brittany, anything else you want to share? That could be anything about your life, about your business, about your, ambitions. We're here to network. Thanks to Becca, give me that idea.
Yeah, I think networking is such a big part of what we do. I noticed it even as a dental assistant, because you might work with the same people twice, but in different offices. Your paths just might cross again, so you may not have to get along with everybody in the office, but it's always important to make sure that you hold yourself as a professional at all times, because you never know who you'll come across again in life, so it's crazy, and it's so important to network and to get over that fear of not meeting new people, because meeting new people is how you're going to get more experiences in life and more expanding of your journey, And I wanted to tell you, I think that you are an amazing, woman who you're leading your company, and you're, just reaching so many students and helping so much. And I know it helped me a lot, and I know you get a lot of messages from students just thanking them. So I wanted to thank you.
It was a big siren out there. I appreciate it very much. And, students is what really feeds my soul. I mean, seeing their success, and not only that, there's a long journey ahead. And you know what, in a way, I think at the end of the day, I benefit from students saying the good word about StudentRDH, or, connecting me to the association. So, like Becca said, it goes back, if you are a nice person, if you stay positive, like you are, bringing everybody here who's joining us today, there's so many opportunities out there. So I can't wait to see all the things that you will continue doing, Brittany, and update us on this amazing working situation that you have planned for yourself is working.
We'll see. Like I said, I'll send a follow-up.
I think I'm an update on that later. That's that. And, I just want to say, everybody, thank you for being here on the Tuesday afternoon. I know it's like I usually do those things on Saturday, but then, with COVID, everything got like a little wacko schedule. Even at clinics, sometimes I heard they have to go over the weekend to finish their requirements and things like that. So that's what I chose to do. Just do it on a weekday and just record it for everybody to see. So everybody check out Brittany's store. And other than that,
thank you guys.
Yeah, it's been amazing. What a nice chat. What a fun conversation we had. And I look forward to, if you ever travel to some sort of conference, if you feel like, I could be there. I go to a lot of conference every year except this year. I would love to meet,
That's definitely, and I haven't been a speaker at a conference before, but I do see that in the future for my Flossy Posse. So if we ever run into each other, or me, or we're in the same vicinity, I'm hitting you up, girl.
For sure. And, I'm sure you have some topics of ideas, but, I myself am a speaker. I was not born a speaker, but, I made I made myself a speaker too. So, and that is also networking. So, hey, let me know. And then some of you don't have your camera on, so I don't see your face. So I'm saying, if you're going to a conference and you recognize me, you can say hi, because sometimes I cannot make the connection between your Instagram name, your face on Instagram, and the real person. So, do that. And I really look forward to just seeing all the amazing things you both ladies are going to do, our presenters, and everybody who joined us today. And I hope COVID is over soon. That's all. So Everybody saying thank you to each other. And, you know, again, I wish you the best. And you know how to reach me, right? clairej@studentrdh.com. So I'm going to leave you here on a Tuesday, and I hope you have a great week. Okay? Bye.